one lens or way of framing health diseases and disorders, and I know the words bad and good are a little bit controversial, but it's having too much of a bad thing in your body and not enough of the good stuff. So like too much virus, too much environmental toxins, too much stress, or not enough B12, not enough sleep, not enough movement. And it's one way of framing things, and it doesn't apply, of course, to everything. Acute disorders are going to not fall into that as well, but cumulative disorders I think really do, and it also is germane in orthopedics. Acute disorders like an ACL rupture, yes, we could say in this framing that it's too much force through the ligament, but we're not kind of reversing the disorder by moving the ligament with force in the other direction, for example. But for the cumulative disorders, the ones that accumulate over time, I think the framing of too much versus too little is appropriate. The classic example, of course, is that we spend most of our days, many of us, in tons of spine flexion and hardly ever, if ever, go into backward bending or spine extension. And I think that is a contributing factor to a lot of spinal disorders, is that too much of flexion and too little of extension. Are flexion and extension necessarily bad or good? No, but in the case of someone who does present with a disorder that we think is caused by that, we could label them, for that one person, bad versus good. Of course, we could do studies where we took some people and we bent them 5,000 times a day or had them sit slouched for all day long over the course of years. My guess is that we would not be able to do those studies, of course, because it would take so long for us to see some results. But at the same time, I fear that people are presenting with these types of disorders younger and younger because the cumulative effects come about so much earlier in life. But outside of the spine, you can also think of it like your knee, for example. If it's in flexion a lot and not in extension a lot, is that a contributing force or a contributing factor to someone's presenting symptoms and disorders? Because I find most orthopedic disorders are problems with joints, I do tend to start to think about how much of a balance or a lack of balance is there? Is there too much left rotation through that joint and not enough right rotation through the joint? Is there too much external rotation and not enough internal rotation? Or pronation versus supination? Muscle tears would be an acute event. Ligament sprains would be an acute event. Bone fractures, acute events. So they're not going to fall into this kind of idea of too much versus too little as a predisposing factor and as a therapeutic idea. Because if we think that there might be too much extension through a joint and not enough flexion through a joint over the course of years, then the therapy would be trying to reverse that imbalance. So this is just a way people can think about it. It's something that I contemplate when I'm, faced with trying to diagnose and therefore subsequently treat orthopedic disorders. I think if we think about our system as having to have balance, it's a nice framework for understanding how things may go wrong and therefore how we can fix them.